The U.S. is seeing a resurgence of measles. Linn County Public Health spoke to physicians who have spent decades caring for Iowans. We asked them to share their experiences with measles and their advice to clinicians who may soon be seeing measles cases for the first time in their careers. Dr. Andrew Barden started medical school in 1983. Since then, he's only ever seen one measles patient. It was the first year of his residency, but it's still a vivid memory.
Boy, I must have been 4 or 5, was brought to the clinic because he wasn't acting right, according to his dad. And he had a funny rash. He was moribund. He was limp, draped over his father's shoulders. He was barely responsive. He was seriously, systemically ill. He was very, very sick. I have never forgotten, he was a wet dish rag draped on his father's chest. Like, he was so sick.
Barden said nothing in his medical training had prepared him for what measles was actually like.
When you're doing the academic part of learning about medicine, you tend to learn groups of things that you have to tell apart. And a common list that you have to figure out and memorize how to tell these things apart is the list of childhood rashes. Typical medical training makes you think of them as rashes. So I thought of measles as a rash. But I'm going to use the word impressive, like the deep impression, the deep abiding thing I learned from seeing that boy in the clinic is that the rash was absolutely, positively the least of his problems.
Physicians who have never seen a case of measles in their careers may soon encounter this disease. What should they know?
You can't diagnose it if you don't think of it, right? If it doesn't occur to you that this might be measles, you won't make the diagnosis, no matter what. I was trained how to be a general pediatrician, and it wasn't on my mind until I saw that boy. But still, after that, it wasn't much on my mind because everybody's vaccinated, right? Like, that's the assumption. And I think for sure in the 21st century in the United States, we have to recognize that for all that stuff that we've considered common childhood diseases, we can no longer assume that the patients we see will have been vaccinated.